In the UK, we've had availability of the cells for, well, what is it now? About a year and a half. So it's December 2018 that we first had access to them. And there was a relatively slow uptake initially. But that's, as the cancer networks hear that they're available, referral pathways are established. So there may well have been a bit of catch up initially where patients perhaps who had relapsed 3 or 4 times rather than just 2 or 3 times were being referred, and these patients may well have been high risk. So I guess as that catch up now has happened and referral pathways have become more established, then we may see the outcomes improving. It's very difficult, though, to know how practices differ between centres. So, in the UK, as I mentioned, patients have to be approved by a panel. Now, the panel is purely there to assess eligibility, and anyone who is eligible is approved. And if patients are approved, they nearly always get leukapheresis slots. What is not happening at the panel level is patient selection beyond the eligibility. So even if somebody has bulky disease, has rapidly progressive, let's say double hit diffuse large B-cell lymphoma, that patient would still be eligible so long as they fill the performance status criteria, comorbidities, etc. Whereas some units around the world, I'm not saying exactly where because it's hard to know, but we certainly hear on the grapevine, if you like, amongst the chatter of lymphoma doctors, that some units around the world may not actually recommend CAR-T for those patients who are sort of blasting through every line of treatment. And it's quite hard to capture every risk factor in baseline characteristics. So when patient cohorts are presented, we always see a baseline characteristics presented that includes things like, percentage with bulk, percentage refractory to their last treatment, but it still doesn't get across all the nuances of individual cases. So it's actually extremely hard to tell how the US, for example, differs from the UK in terms of patient selection. So although there may be some factors explaining it, I think there's a lot that's going on at an individual centre level that we just aren't aware of.